Well, let's go back to our interview with Health Undersecretary and DOH spokesperson Maria Rosario Vergeire. Ma'am?
Yes, ma'am. Good evening.
Okay, yan. Now I can hear you. Just go on the day that we have 22,000 plus cases. That's the day pa naman na hindi ako makarinig ng interviews ng on-air. Anyway, ma'am, well, my question earlier was that, you know, what's happening to us? Ano pong nangyayari sa atin? How did we get to this point? We are, I think, the only country in the world that requires face shields. We have had a series of lockdowns left and right. If they are not the ECQ or the MECQ or the GCQ, we have granular lockdowns left and right. Our hospitals are full. Nagkasabay pa sa mga controversy on fund disbursements, dropping the ball on healthcare workers' benefits. What are things coming to, ma'am? What's going on?
Yes, ma'am. No, so based on our projections, we really are expecting that cases will continue to increase. Even in the coming weeks, these numbers will be increasing. This is because of the higher transmissibility of this Delta variant, which we are seeing as increasing day by day among the detections that we are having. The strategy of doing wide citywide or province-wide community quarantine, according to our experts, it's not working anymore. That's why we are shifting our policies, that we are more on focusing in this for these granular lockdowns in the different communities. So what we are seeing right now is expected, but we need to remember that even though the number of cases are rising, we just have to keep our severe and critical cases at that level where we have right now, which is less than 2%, so that we can still accommodate them and our healthcare system will not collapse.
Ma'am, you said in the coming weeks, we expect that tataas pa po ang bilang ng cases. August 30 po ngayon. Are you saying that within this month of September, we are going to have what, ma'am? 25 to 30,000 or 35,000 cases a day? Is that what we are looking at in the next few weeks?
Well, actually, ma'am, based on our projections done by our experts, especially here in NCR, for example, by the end of August 31, it was projected that if we have this MECQ period followed by the previous ECQ period, we will have about 83,000 cases by the end of August 31. Currently, our active cases right now in NCR is about 41,000. So if we can see, if we can observe, we were not able to reach that projected number. And that is good for all of us because we think that the effects of the interventions done in the previous weeks are now coming into effect. But we cannot be complacent at this point because, as I have said, the projections, even though we have this kind of positive effect in our numbers, we can still see that the cases will continue to increase. And by the end of September, the projection is about 152,000. Even though even though the factors or the interventions will be improved, we will still see this increase in cases.
Ma'am, when you say 152,000 cases end September, can you, translate that into how many cases per day that will be reported nationwide? Just so that we can, so that it's more understandable to us. Kung ngayon 22,000, sa September 15 po, September 25, mga ilang kaso po yan araw-araw?
Yes, ma'am. No? So actually, ito pong pinag-uusapan natin na 152,000. These are active cases. So currently, we have 41,000 active cases in the National Capital Region. And as I've said, we have projected around 83,000 by the end of August. So we are looking at right now an average of about 17,000 cases per day, 7-day moving average in the National Capital Region. So it's August 30 right now. So if we are talking about double of this 83,000, maybe we can have per day 30 plus thousand. But we need to remember also that there are factors that can improve this kind of situation, that we will not reach this 152,000 if we can improve vaccine coverage, if we can be able to shorten the duration between detection to isolation, and if we can also improve on the compliance to these safety protocols that we have.
Ma'am, earlier you said at the very least, one thing that we should be, thankful for is that our severe and critical cases is only at 2%. Nung nag-umpisa po tayo nung March 2020 ng unang lockdown, were we at 2% for severe and critical cases?
Yes, ma'am. No? So, nung March and April tayo, nasa ganung range lang din po tayo for severe and critical. But the difference right now would be that we have expanded beds kasi. So, during the March and April, pag tinignan ho natin, we were really challenged during those times because of the limited number of beds. But we were able to prepare and we were able to expand the number of beds, especially ICU beds here in NCR, for example. Kaya nga po ngayon, hindi po ganun ang ating system as compared to the March and April. We still can accommodate patients, although there are lines in our emergency rooms, but this would be based on the conditions of the patients that are lining up in the ER. And sometimes, inaantay po kasi yung mga COVID test kaya hindi pa maipasok. Pero yung atin pong COVID referral hospital ngayon, for example, ang ating Tala Hospital, meron ho tayo dyan 114 ICU beds. Sa ngayon po, 48% ang capacity pa lang. So isa po yan sa ginagawa naming flags. Kapag nung March and April kasi, 2 linggo pa lang into the rise in the number of cases, puno na po itong ating ICU beds sa Tala at sa ibang mga ospital. Pero ngayon, mas nakakahinga po ang sistema because of the expansion of the number of beds.
Yeah. Well, of course, ma'am, like you said, no, we cannot afford to be complacent, and we should be as vigilant or even more vigilant. Like you said, the health protocols still apply. Itong vaccine coverage, ma'am, how are we doing? Are we catching up? Are we hitting our targets? Because that is one source of relief for people, knowing that they can get vaccinated or that they already have their first or second dose.
Yes, ma'am. No, actually, so ngayon po, we almost have 14 million fully vaccinated individuals already. So pag tinignan ho natin yung rate of increase natin per week, malaki po ang naging difference, no? Especially during the time that we had the ECQs and the MECQs, because local governments were able to focus really on vaccinating individuals. What we really need to do right now is to continue on improving this vaccination so that we can have more protection for the population. But I'd like to point out that these vaccinations and the effect of these vaccinations will be felt on our numbers maybe a month after these vaccinations. Alam po natin that it will take time before we can say that a person is truly vaccinated or fully vaccinated. So as to the effect on this in our numbers, we can see that maybe 1 month after. But we are already seeing this for those who are fully vaccinated already. Kasi nga nakikita po natin that more of those who are having these severe forms of the disease are those unvaccinated individuals.
Do we still have a problem, ma'am, with vaccine hesitancy, or is it really more vaccine supply? Because, all of us have heard of people who want to get vaccinated, naka-line up na sila sa mga e-registration ng mga LGU, hindi lang po dito sa Metro Manila, pati sa labas po, sa mga probinsya, pero kulang ang supply. So, ang problema na lang po talaga is supply. Ganun po yan, ma'am?
Yes, ma'am. We are still seeing this confidence na medyo sa ibang mga bahagi or ibang sektor, talagang mababa pa rin po yung kumpiyansa sa bakuna. That's why we are really hammering on dito po sa mga information natin na binibigay. Pero nakita natin yung tremendous improvement dito po sa mga kumpiyansa sa bakuna. Nakita natin marami na po talagang gusto magpabakuna. And we think that these are two challenges that we are now faced with. First would be, of course, the confidence of people in our vaccines, and the second would be really supplies. Pero ngayon naman pong dumadating na at medyo nagiging stable ang ating mga deliveries ng bakuna, ang ating pong vaccine czar, si Secretary Galvez, has already announced that for these next tranches of vaccines, we will be distributing this to the other areas outside of NCR para makahabol din po sila, and they can also improve on their vaccine coverage, especially dun po sa mga vulnerable individuals natin.
All right, ma'am. Yusek Maria Rosario, Vergeire of the Health Department. Thank you very much, ma'am, for being with us tonight.